G'day, it's Dr. Joss here. I just wanted to talk to you about what you should do if you are sick. The most common symptoms that we get with the coronavirus are fever, cough, and fatigue. There are other symptoms that you can get as well, like sore throats, muscle aches and pains, even diarrhea some people have, and abdominal pains. But the most common ones are fever, cough, and fatigue. So if you have any respiratory symptoms like this, the first thing we need to think about is how unwell are you? So testing for coronavirus and whether you're positive or negative is one side of the coin, but more importantly, I think, is that how well or how unwell are you? Are you well enough to be at home on your own, because we need to be in self-isolation if we have a respiratory illness at the moment. But if you are unwell, then you need to be assessed by a medical professional, and this could be your GP or it could be a doctor in the ED. So the main problem that people have that require them to be in hospital is usually associated with their breathing. So shortness of breath is a symptom that would require you to be in hospital potentially. So if you're worried about your breathing, then I would strongly consider calling 000, or at least phoning a GP and having a chat to them. They can do an assessment over the phone or over video conference, or possibly even in person if they're set up to do that, and then make a decision as to what care you need, and then checking in regularly, because you might be fine today but not tomorrow. So that's the first thing that I want to say about what you should do if you are sick, is please be assessed by a medical professional. And then the next question is, do you need to be tested for coronavirus? Because there are other viruses that cause us to have respiratory symptoms, just like has always been the case. So the current testing criteria, and this changes regularly, is you should be tested if you have travelled in the last 14 days and you have either respiratory symptoms or a fever. The second criteria is that you've been in close contact with someone who is a confirmed case in the last 14 days, and then you also develop respiratory symptoms or a fever. The third criteria is if you're in hospital with a severe community-acquired pneumonia and there's no other cause found. And then the final criteria is if you're a healthcare worker and you develop respiratory symptoms or a fever. You should be tested. Now, there's been lots of criticism about the fact that we may or may not be testing enough people, and I can completely understand the concern. It would be nice if we could just test everybody left, right, and center, but there's a few things that go against this. So the first and most obvious one is that we do have a limited supply of testing kits. So at some point we would run out if we decided to test everybody. And this is not a good thing, because if we run out, then we can't test the people who we really need to test. The second thing is that every test needs to be processed in a lab. So this takes time. There's already a backlog of test cases. I know the ones in Bundaberg take 2 to 3 days to come back. And this is valuable time where we're waiting to see if someone's positive, and they may have had contact with people, so it delays the contact tracing, all those sorts of things. So if we started testing everybody, I can imagine that this would blow out to weeks to get a result back. And that's going to change the way we can control the spread of this disease. So that's another important thing. The other thing is that having a negative test result doesn't mean you can't catch the disease tomorrow or next week. So being tested if you're asymptomatic really doesn't mean anything. And testing negative if you have respiratory illness, but you don't fit that criteria, again, doesn't mean anything, because you could contract the virus next week. So, are we testing enough people? Well, if you look at the stats of our total number of tests, and then our total number of negative cases and our total number of positive cases, it actually looks like we're doing a really good job. So we've currently done about 270,000 tests in Australia, and we have just under 5,000 cases. So that's a positive test rate of about 2%. And if we compare that to testing of other diseases that we've done in the past, we know that that 2% positive rate means that we're capturing pretty much everybody. So we're not missing many people with coronavirus at this stage. which is a good thing. So I think that given all those facts, if we weigh everything up, we are testing appropriately. Now, in areas where there is community transmission, we are relaxing the criteria and testing more people. So rest assured, if that happens or starts to happen in Bundaberg, then the criteria for testing will change, and it will be more appropriate to continue trying to capture and being able to contact trace and stay on top of it. So I don't think we need to worry about the testing criteria. I think we're doing a good job of it. Now, also, the government is setting up respiratory clinics across the country. And the idea of this is somewhere where you can go safely and be assessed by a medical professional and also tested if necessary. And the idea of this is to take sick people away from other GP practices, to take sick people away from the hospitals, so that we have a safe space where we're not causing spread of the disease if people come who do have coronavirus. I know that is being looked into in Bundaberg and hopefully won't be too far away. That's the most important take-home message out of this, is to think about your own health if you're sick. So please self-isolate if you are sick. Please contact a medical professional, whether it's your GP or 000, or you can call the coronavirus helpline, which is 1-800-020-080. I'll post that number as well. So please continue to stay home, stay safe. Please keep liking and sharing the videos, getting it out there. There's still lots of people we can help in Bundy by getting this message out there. And I'll talk to you again soon. Catch ya.